Hello everybody, I'm Charing Zhang from the Department of Surgery, the Chinese University of Hong Kong.
And I'm Dr. Raymond Tang from the Department of Medicine and Therapeutics in the Chinese University of Hong Kong.
First of all, we would like to thank GIE for publishing our article on contrast-enhanced EUS versus conventional EUS guided FNB with macroscopic on-site evaluation for solid pancreatic lesion. It is an international multicenter randomized controlled trial.
So Charing, why do we want to perform this study?
Well, it is a very good question. As we all know, endoscopic ultrasound guided FNB is the preferred method for tissue acquisition for pancreatic solid lesions. However, the false negative result may occur if FNB is performed in the avascular area of the pancreatic solid lesion. And the sensitivity of EUS FNA for pancreatic adenocarcinoma with avascular area was previously reported to be lower than that for the lesion without avascular area. Contrast-enhanced EUS allows a better real-time delineation of the lesion vascularity, and it may help to avoid a vascular area in solid lesion during EUS-guided tissue acquisition. However, limited data is available on whether contrast-enhanced EUS-guided FNB would lead to a lower false negative rate of the FNB in pancreatic solid lesion. And therefore, we designed these multicenter randomized controlled trials to compare the diagnostic performance of contrast-enhanced EUS versus conventional EUS-guided FNB with macroscopic on-site evaluation for pancreatic solid lesions.
So in this study, 128 patients were recruited from 3 centers, including Hong Kong, Italy, and Korea. For inclusion criteria, patients with pancreatic solid lesions at least 1 centimeter in size who were referred for EUS-guided FNB can be included in the study. In the conventional EUS-guided FNB arm, a 22-gauge Francine needle was used for tissue acquisition. Macroscopic on-site evaluation was used to assess specimen adequacy. At least 4 mm macroscopic visible core is necessary to declare specimen adequacy, and a maximum of 7 passes was allowed. In the contrast-enhanced EUS-guided FNB arm, again, a 22-gauge Francine needle was used for tissue acquisition, but before that, contrast EUS was performed with the contrast agent Sonaview to identify the area of avascularity. Most was again used to assess specimen adequacy, and again, at least a 4 mm macroscopic visible core was necessary to declare adequacy. A maximum of 7 passes of FNB was allowed. The primary outcome was false negative rate of the assigned study technique. The secondary outcomes include sensitivity, specificity, positive predictive value, negative predictive value, procedure time, and procedure-related complications of the assigned technique.
So, a total of 128 patients were randomized with 64 patients in each group. BMO EUS identified a vascular area in 25% of the solid pancreatic lesion in the contrast EUS group and 20% of the solid pancreatic lesion in the conventional EUS group. And contrast-enhanced EUS further increased the avascular area detected in solid pancreatic lesion from 25% to 31% in the contrast group. The false negative rate, sensitivity, specificity, diagnostic accuracy, and number of passes to achieve MV. The false negative rate, sensitivity, specificity, diagnostic accuracy, number of passes to achieve MCV of more than 4 mm, and the mean MCV length were similar in both groups.
So we believe this study adds to the current knowledge in the following ways. First of all, it confirms the findings in a recent single-center randomized controlled trial comparing contrast EUS-guided FNB versus fanning technique in solid pancreatic lesions. In that study, a very high diagnostic yield by the FNB needles was found in both groups. And also, in this study, we found that when dedicated FNB needle was used for tissue acquisition, perhaps routine use of contrast-enhanced EUS was not necessary to guide FNB because tissue procurement yield was already very good with the modern dedicated FNB needles.
Yes, this is the conclusion of our study. Thank you for your kind attention. Thank you.